Good afternoon, ladies and gentlemen. Welcome to my show, Lifestyle with Dr. Mobi. I'm Dr. Mobi, and today we're gonna talk very important topic, which is medical terminologies and end of life care issues. So most of people don't know what the options are or what these terminologies mean, and that they find it very difficult to navigate through these choices and for their loved ones, whichever level they are, but mostly if they are at a certain age, they have to decide about what treatments are beneficial and what are the options and what is the best route for this medical management of anyone. So it's very important to realize and appreciate about all these terms. So we're gonna discuss with one of the specialists who is a geriatric specialist, and he deals with every day with these terminologies and tries to explain in detail about these treatment options. So let's welcome Dr. Jamil. Dr. Jamil, welcome you to our show. Tell us about yourself a little bit.
Okay, thank you. I'm an internist and also a geriatrician, so I'm involved with taking care of older people. And older people comes with its own challenges. And when you have to see a patient in older people, that you have to think about not only their health, their social issue, financial issues, how things going to change as we get older. And one of the things that comes to our mind is decision making. So in United States, it's a growing population, and it's happening not only in United States, also all developing countries. And it's a global problem that we are getting older. And there's a lot of terms comes into the place. One is a baby boomer. Anybody who born between 1944 and 1964 are called baby boomers. They came after Second World War. There was a lot of children born at that time. And after all these years, they are passing the age 65 and getting older every day. There's different other names they have used. They call shockwave. Another thing is called the pig in the python. It means that, when the python swallows a prey, it gets stuck in the middle, and the middle part, it gets bigger. In our population, that middle part of our demographic is much bigger. It used to be bigger at the lower part. Now it's going slowly upwards, and it's happening all over the world.
Yeah. Wow. Those are the nice terminologies. So tell us a little more about, beside baby boomers, what other, anybody beside 64, what other terms they use?
As you say, aging population is one thing, and few challenges that we'll face, and that's also will be opportunities. Like there'll be a big business taking care of older people, their needs and the entertainment and the customer service, and they will be one of the largest block of people who will be voting.
Oh, okay.
So there'll be a lot of changes in our laws in this country taking care of older people, because they will be in the driver's seat in coming years.
Yeah, that's true.
And in 2030, that is 10 years from now, all the baby boomers will be over 65. And 1 in 5 people will be in retirement.
Okay.
So this is the first time that our population will be more in the 65 group than less.
Then this.
Now we have 46 million people over age 65. In 2050, that will be 90 million.
Wow.
So it will be an enormous number that they will eat out. They're not going to drive too much.
Yeah.
All those things that will come. So what do you do? One is you do retirement planning.
Yeah. Planning is very important.
And then they will travel a lot. So there'll be a lot of hotel businesses because they will go to different places. And also entertainment, that will be more catered to older people, not younger people. And that will be a good thing.
Yeah.
There'll be a lot of things will happen. Will be taking care of healthcare because there'll be a sicker group of people compared to the younger people. When we go to the hospital, few things that we all get asked, that I see that patient's family get all puzzled. What does it mean? One is advance directive. It is a document that you have to write it down, telling your siblings or a family member what you want them to do about your healthcare when you're not able to say anything or you're too weak to say anything. Then there will be a power of attorney, POA. There will be a word called 5 wishes will come to in play. I will go into detail a little bit later. There will be code status, how you want to be treated, whether you want IV antibiotics, get shocked if your heart stops, if you can't breathe, if you want to be on a ventilator. If you say, I want everything, you'll be a full code. If you say nothing, then they'll put you in a category called DNR, do not resuscitate. Another condition is called, terminology is called DNI. It means do not intubate. There will be a condition or a terminology called palliative care. It means, do you like to be kept comfortable on the top of what medication you take? Or you want to be, there's a paper called POLST, P-O-L-S-T. That is a paper signed by the doctor stating your wishes. And it's a brightly colored paper, and it has few things that what your wishes are, and it is a legal document. And a doctor can sign it, a physician assistant can sign it, and it is valid. I know these all words will make you confused because some of you probably hearing it for the first time. And it is not new. So I like to go a little bit in more detail just to explain what to expect.
So tell us a little bit about, I think for audience to understand the code status, I'll just simplify a little bit. So when we go to hospital, they ask this to fill this paper which has these options, whether you intubate, put a tube down the throat, whether IV antibiotics can continue, whether CPR, which is chest compressions, can happen. So now you can pick and choose. As a hospital has more of these options, which you can say, no, I don't want CPR, I don't want intubation, I just want IV fluids and antibiotic labs, those can continue. So you can do that, and you have to be, in my opinion, a little bit realistic that there's one thing what we want, but there's another thing which, somebody's chest can take those recoils of chest compression. So it has happened that people try to resuscitate them and they break their bones or ribs because they cannot actually have that strength to go through. So we have to be a little bit realistic on that, that what their body can handle. So I think tell us a little bit about those other options, palliative care and so forth. You can define those.
May I go into the power attorney?
Sure.
And this is a very important part of the whole thing. When you're not able to say what you want, at that point, or point before that, you select a person that you can trust, and they will make a decision according to your wishes. And it's only going to make decision when you're not able to. Suppose you make a decision and you came out of the problems and you're good again. At that point, your power of attorney is not going to make a decision. At that point, you will make the decision. So you can overrule everything your power of attorney is doing if you are capable to do that. So it is not a permanent thing. And so it is a medical direction, and it's like a living will you can make. But there are some other things in the market or that we follow, which is more comprehensive and taking into account a lot of other stuff. One is called 5 Wishes. 5 Wishes is a document they made by Aging with Dignity. They made this advance directive, power of attorney, all together in few pages. Number 1 is you have to select a power of attorney. So that I told you that you have to select somebody you can trust.
Yeah.
They'll be follow your instruction. Number 2, you have to decide whether do you like to have a life-sustaining measures or not. It can be anything. If you have a heart failure, if you have a heart attack, do you like to have a medication that make your heart going, or do you like to have a cardiac catheterization or things like that? You can make that decision. But say, no, I'm living my good life, and I don't want to prolong it if it's not going to give me a quality of life. So you can also decide about same thing about CPR. You can do dialysis if your kidney fails, or antibiotic, or if your blood count drops, do you like to have a blood transfusion? You can signify or designate your people that, in that case, you make the decision that I do not want to have a blood transfusion for no reason. And it will be hard for the family sometimes to stand by and not do nothing, but you take in charge of everything before the time comes. Number 3 will be comfort care. What do you mean by comfort care? Do you like to have medication to keep you pain-free? Do you like to have medicine so that you don't suffer from breathing? And number 4 will be who wants to be with you, or do you like to be at home or at the hospital at the end of your life? If you say that you want to be at home, then you go at home and go to another life after this life, and among your friends and family. And number 5 will be talk to your priest, talk to your counselor, to your imam. It doesn't matter what religious domain you have, and so that you can come to a closure. It is very important to forgive everything. Forgiveness is not only forgive them, but also relieve your burden that you carry all your life. So that is also part of the 5 wishes. And then you need a witness, and you sign, and it's a legal document. And it can be taken to doctor's office, you can take it to the hospital, or any place you go, and they will honor it.
That's really, I think it touched a lot of souls about when you said, you forgive everything yourself first, and everybody else, you release actually a lot of tension on your mind and somebody else. So those are very important things. And other thing is, you mentioned where you want to be among your loved ones, and some people actually, patients prefer to have their end of life care at home, and where hospice or palliative care, then we can talk a little bit on that. Okay. What is the difference between those options?
In a hospice, there are certain conditions, like you have a cancer, terminal cancer, or you have a lung disease that declining so fast that you have on oxygen and you cannot survive without oxygen even high rate. At that point, you know that you're not going to live too long. And normally the terminology is that if you think that your lifespan is less than 6 months, you can get into the hospice program. It means that they're not going to give you medication which is not necessary. They will only give you medication that will make you pain-free and not breathing problems or anxiety. In palliative care, they will do most of the things that you're already doing, like your medicine for blood pressure or heart medicine. If you have to go to the doctor, it will still go. But they will give you extra care with the medications, like a pain medication, medicine for anxiety, to keep comfortable. There is another form. There is no end to the forms in healthcare.
Yeah.
And they call POLST. It stands for Physician Ordered Life-Sustaining Treatment. It is a doctor or a PA or a certified nurse practitioner. They can sign the paper. They make a one-page paper instead of long pages from other papers. It has 3 things in it. One is, do you like to have a CPR or not?
Okay.
Number 2 will be, how much comfort measures you need or want. Do you like to have an IV fluid or not? Do you like to have an antibiotic or not? That's all. And after that, CRNP, PA, or a doctor will sign the paper, and it is valid. You can take it to the hospital if you get sick, and they will honor it.
So it's not a legal document, it's actually a medical provider who signs it.
Yes.
Okay, so that's the difference. Then the other thing I think we would like to share with the audience is end-of-life care is also involves that understanding some of the physiology which is happening at that point in life. There can be decreased appetite, decrease or your mentation, that you don't know where you are, and then you could be breathing very hard, so this could be that. And there is a loss of due to appetite, you might lose muscle mass and all those. And then becomes, some of the question is artificial feeding and artificial the supplementation. Tell us a little bit about those options. Do they have that with palliative care or no?
Usually not.
Usually not.
No, yes, and there is always a gray areas.
Okay.
And people will ask whether can I have a nutritional supplements. But yes, you can.
You can,
but
not put in tubes.
Not putting tubes and things like that, because hospice probably will not. You should not be in a hospice care if you want to actively try to prolong your life.
Prolong it. Okay. So that's important. Now the nutrition, of course, you can feed by mouth, but if they are weak and they can't take it, then the tube is option. But remember, that's not an option for hospice or palliative care. So so if it's more of more care is needed, then maybe you should think on those lines. So also remember that you have to take care of other emotional needs, and those are important. I think Dr. Jamil mentioned, sometimes we call priests, sometimes we call imam, sometimes whichever religious domains they have, probably at that point they feel that is more important in their life than doing labs and all those blood work.
Yes.
Right?
And once you enroll in hospice care, it doesn't mean that you have to be there.
Okay.
If you ever decide that I don't want to be in hospice care, I want to go to the hospital, I want to be treated actively, you always can say no, and you can go.
Oh, okay.
So it is not end of everything.
And
so if you, as we will get older, and some of us will not be able to stay at home.
Yeah.
And if you go to the hospital and you're too weak to go back home, they will give you a choice. Do you like to go home with the home health? Or do you like to go to a nursing home and get more intensive health care? And so that's the point will come with the skill level of care. Skill level of care is covered by insurance for a certain amount of time. And after that, you have to give a percentage of the total bill. But that is expensive if you have to stay for a longer period of time. But if you exhaust everything, sometimes medical assistance will kick in and help you with the payment. Other choices, whether you do you like to go to a personal care home.
Personal care, yeah.
Personal care home is a situation where you will be almost independent.
Okay.
And you'll be able to handle your medications. You'll be able to walk around and you use your restroom, and you'll be able to take care of your, they call activities of daily living. It means combing your hair, feeding yourself. And then will be assisted living, which is a little more expensive. And they will have good nursing care.
Okay.
They will give you administrative medications, and they're also almost like a personal care home, but a little higher level, and it also costs a little bit more.
So those for audience, skilled care will be probably covered by most of insurance, but assisted living and personal care might not be. So make sure you check the financials, and also it's very important that skilled, they're going for physical therapy and strength training, and so the independence is ability to function a little bit independence with ADL. We call them activity of daily living, which is combing, washing, clothing. So those are very, very important. So make sure you are well versed with whether they can do it and whether you can afford. So those two are very important things to consider on those. So also we are coming to the end of show. So let's summarize for our audience any important points you want to deliver before.
You know, in our lifetime, we'll all have to face this time.
Yeah.
And it is better to be prepared. That will be good for me and also good for the family. They will not have to make a tough decision whether to put me in a hospice care or a DNR situation. It will be taking a load out of their heart or their life to make a decision like that on their parents. It is better that I do that, I initiate it, so that they understand what was my last wishes and they will be respecting that.
Okay, well, thank you. It was great talking. So I will just wrap up in the end. Just make sure, try to do this when you are actually more alert, and when you are not at that point. That's the best, is to talk a little bit earlier than in your life and give your wishes and whatever you like, at least some idea to your family. So please give us feedback on Twitter, email. Our addresses are down there. And thank you for watching our show. It's been always pleasure, and welcoming you back. Thank you, Dr. Jamil, and we'll see you next time.
All right, thank you.
Take care,
Thank you.
and bye.